Right. Can everyone see the screen?
Yes, it looks fine.
Brilliant. Okay, so just doing the preliminary checks. Right. So thank you all for attending this webinar this morning, and a huge thank you to GOURI once again for this opportunity, just for us all to get together and just learn about a very exciting, innovative new product. So just in case some of you are wondering a little bit about me, probably the most boring slide here, if I may be honest. But you know, my main job, if you like, is teaching and sharing experience both nationally and internationally. And as you can see, a little bit of a snippet of my bio right here in front of you. So if you guys have any questions, even after this webinar, feel free to connect with me on social media. And I'll be more than happy to answer any questions related to GOURI, the protocols, or any issues that may arise. So without further ado, just looking at the introduction here of GOURI. So some of you are already aware of this product. For others, it's quite a new concept, given I think it's safe to assume that most injectors globally are very familiar with HA, hyaluronic acid-based products. So for some of us, this might be quite a new and exciting concept. So it is the first fully liquid polycaprolactone-based product, which I'll go into a little bit more detail as to what that is. And I'll even talk later on as to what the advantages of this product are compared with other products on the market. And of course, we do have the patented technology, which I have another slide on shortly. I suppose in very basic terms, most people will give this a very broad term of a skin booster. And I suppose, you know, the primary role of this product is collagenesis, to produce collagen, to rejuvenate the skin, which is the outermost feature of the face, which I feel is quite often overlooked in facial aesthetics. We're all very good at doing lip enhancement, nose jobs, cheek fillers, jaw lines, etc., which is all very good. However, when a patient is seen in front of you, I think sometimes we overlook the skin, and they might have a few fine lines and wrinkles, but unfortunately, Botox and fillers aren't the only things that can be done to address these concerns. So sometimes we do need to look at skin products, if you like, which can address some of these concerns. So let's have a very quick look at collagen, which is the most abundant protein throughout, you know, the human body. It's found everywhere. There's various types. And as we already know, going back to basics, fibroblasts, which are found in the deep dermis, produce collagen. And when we are wanting to rejuvenate the skin, the whole concept is to try and produce collagen. Because from your mid-20s onwards, you begin to lose, excuse me, a certain amount of collagen on an annual basis. In fact, quite an interesting fact here, most of the body's collagen, in fact, around 50% of the entire body's collagen is found within the skin, which is quite a very important fact there if you think about that. So most of your collagen is in the skin, and as we get older, from your mid to late 20s onwards, the amount of collagen is reducing every year, which is why we start seeing fine lines and wrinkles. And you have a nice image here in front of you on the left-hand side, where you can see almost a depression or a wrinkle or a fold that begins to develop because of lack of collagen. Sometimes I like to think of collagen as scaffolding to a building. So you can imagine on the external of a house, you have all the scaffolding poles, and it keeps the building upright and erect and strong. In the same way, collagen is needed for the infrastructure of the skin. On the right-hand side, we have an image of basically what we call the ECM. So that's the extracellular matrix, within which you have hyaluronic acid, which is a gag. You have elastin, you have water, and so forth. So let's have a little bit of a look at the actual technology. Collagenesis enabled solubilized, active, and biodegradable polymer technology. Quite a mouthful, hence the abbreviation CESABP. And essentially, in a nutshell, this is a injectable, which, as I said earlier on, is indicated for collagenesis. And if I have already mentioned to you earlier on that from your mid to late 20s, you eventually start to lose collagen every year, that should give you a rough idea as to what kind of patient you can treat and from what age. So probably not going to be licensed on a global scale to be used on an 18-year-old. However, somebody in their late 20s onwards throughout various decades of life can safely be treated with this product. Of course, always managing patient expectations first. In terms of just looking at what we mean by fully solubilized, well, what we have here in front of you is an image, and you can see on the left-hand side is slightly transparent, whereas on the right-hand side, you can see some of the particles have just dropped down to the bottom because of gravity, so they're not dissolving. So the fact that we have a fully liquid based product is very innovative. And the purpose of this, I have an actual slide for this later on in this presentation, which will probably explain why having something that is fully liquidized compared with what's already on the market, which is PCL with microparticles, and why GOURI would have an advantage. So I'll explain that later on. So just another brief slide. I'm not going to bore you too much with this, but again, just going over what I said earlier on, which is the whole concept of losing the structure, the scaffolding to the skin as we age. And this is what happens, as you can see here. And on the third image, what you'll see here is when we inject GOURI into the deep dermis, it's going to stimulate the fibroblast activation, which will then produce collagen and then again produces a structure. This was a nice study just done just over a year and a half ago, I believe it was published. And you have a control on the left side, which is some saline, phosphate buffer saline, and on the right-hand side, you have GOURI. And although this was done in rat models, I believe what you can see here is the density of the collagen after 6 weeks. So, the purpose of this slide is to show to you, we're not just telling you this product works, we're actually proving to you that even on a histological level, we can actually see the increased density of collagen and the fibroblast network after 4 to 6 weeks. So a very powerful slide here, just to evidence what we have. Let's have a look at the indications. So where would we use this product? So brilliant, you now have this product sitting in front of you in your office, and where do we use this? So again, we're very good at seeing patients when they come in and we think, right, you have nasolabial folds, let's fill the folds, let's do some cheek filler. And as I said earlier on, we often forget about the skin, or we're unsure what to do with the skin. Now, hopefully, everybody doesn't mind, and I will apologize in advance if I mention other brands. So a brand I am going to mention is Profilo, and I mention this brand because it's quite a popular brand. So, I'm not here trying to discourage any other brand. I think every brand has a role in the market. But for sake of comparison, I will mention Profilo because I'm assuming many of you have heard of Profilo, probably because of the massive marketing budget that they have, and it is a good product. But I will compare this with Profilo and why this has become my product of choice for addressing skin. However, let's see where they are similar. Both of these products are indicated for these indications that you see in front of you. So fine lines, loose skin, dehydration, poor texture, etc. Now, one common area that you'll see this within the face is the lower 2/3. So if you picture the eyes, so this is the lateral canthus, from the level of the lateral canthus right the way down to the line of the mandible, this is an area where the skin is quite profusely seen in terms of fine lines and wrinkles as we get older. In the upper third of the face, of course, you have wrinkles. What do? We use Botox. That's always going to be the gold standard for the upper third. But we do have an exciting full face protocol, which I'll share with you later on. So as I was saying, most fine lines and wrinkles you should begin to see in the mid face, lower face area, just here. You can't put Botox in there because they won't smile. You can't put filler in there because it may create heaviness due to the hydrophilic nature, as well as gravity pulling things down. So sometimes we need to put something directly in the skin, and these are the indications. as I said, I'll compare why I would choose GOURI over brands such as Profilo later on. So contraindications. So some of these are what I call absolute contraindications, whereas others, I suppose you can argue, are relative contraindications. For example, you may still be able to go ahead, provided you warn the patient. For example, the first one, if they're on aspirin, anticoagulants, if they understand that there's a risk of bleeding, hence causing bruising, then if you can manage the expectation, I suppose with good documentation, there's nothing stopping you from carrying out the treatment. However, there are going to be things that are absolute contraindications, which means you would not treat the patient. For example, severe uncontrolled autoimmune conditions like very poorly controlled thyroid disease or diabetes, where the infection risk is higher, immunocompromised patients, known hypersensitivity, and obviously pregnancy or breastfeeding. For the first two, I suppose you can argue they are probably more relative contraindications. Very similar as opposed to, I'm going to say, most injectables on the market. So let's have a look at the safety of this product. So nothing significant, to my knowledge, has been reported to date. So, that's a very reassuring fact. It's still a relatively new product on the market compared to things like Profilo, for example, that have been around for many years. So relatively new. However, it's very good to know that the protocols have been evolving, and I'm sure some of you have been in touch or kept up to date with GOURI since it was launched. So you may have noticed one or two tweaks, which is always very positive from a manufacturer perspective, because I don't want to see a product on the market and here it is, it's launched and off you go. The fact that things might be tweaked and changed just goes to show that the manufacturers genuinely do have the patient and the patient safety at the forefront of everything. So some of you may have been noticing a few changes, etc. However, it's very safe. As I said, nothing has been reported to date. It's fully biodegradable and biocompatible, and non-toxic, as you would expect from any injectable that is injected in this day and age. So there's no need to prep the product either, which some of you may have heard of the product called Sculptra, PLLA, polyl lactic acid. Sometimes you need to ferment the product around 24 hours or so prior treatment. And again, there's no need to do that with this product. It's fully made for you in the syringe and off you go. And it's something that we like to call the 3 S's. So spreadability. So because it's fully liquid, your diameter of reach is larger compared with a product that is cross-linked as a HA product, for example, Profilo. Your sustainability. Okay, so you get your long-lasting results with this, as you've seen from the study I've shown you earlier on, and a very high safety profile. So let's have a look at the injection protocols. So what you see in front of you is just is for the full face. Okay, now I'm going to take a step back and first show you the first protocol, which is just a 1 syringe protocol, and then the second one is a full face protocol, which is 2 syringes. So this is the 1 syringe protocol. Now, there's a couple of reasons why we have this protocol in place. Firstly, I guess, would be a financial implication. Sometimes patients cannot afford to have 2 syringes, 3 syringes, etc. So it's quite reassuring to know that we can address the bulk of the concerns, which, as I said earlier on, tend to be in the lower 2/3 of the face. And we can do this safely with 1 syringe. So what do we have here? So if you look at the image and focus on the image on the right-hand side, we have 1 syringe. And what we are going to be doing is splitting this into almost 4 segments. So we have an entry point on the lateral zygoma on each side. We are using a 25 gauge needle, and we are going to introduce the cannula. And what we are going to do is a couple of, I'm not going to say threads, but a couple of segments on each side with 1/4 ml. So 0.25 cc, which is 1/4 ml, into each of these red lines that you can see here in front of you. I would suggest a very small amount of fanning and linear threading technique at this place. Don't be very aggressive thinking you need to cover the entire face. And the reason I say this is because what I said in the previous slide. spreadability. This product is fully liquid, and once you are in the subdermal plane with the cannula, it will begin to spread evenly throughout the skin. So this is basically the one syringe protocol. So just think of your lateral entry point high up on the zygoma, and you've got 4 main segments with 1/4 of a mil that is going to be spread in a linear thread retrograde fanning technique. Of course, local anesthesia is always going to be advisable. Now, what we would suggest is just a little bit of topical anesthesia again, in the area of the entry point. Some of you may prefer to use injectables as anesthesia, but this comes down to personal preference. I have also sometimes injected without any. So the whole concept of anesthesia, I'm going to leave down to you as the individual, as the clinician, to make that decision as to what you feel will be fit for your patients. But this is the protocol with one syringe. In terms of your landmark, so you're probably thinking, right, I enter at the lateral zygoma. Now, where am I heading to with the cannula? So as a rough ball mark, the first line should almost be heading to the nostril, so the alar of the nose, and the other one should be heading towards the oral commissure, or the chin, if you like, so almost in a downward vector. So that's the where you should be aiming with your cannula, more or less. And obviously things can be tweaked, you don't need to be extremely strict with this, but this is all down to your own experience and discretion. So that was the one syringe protocol. And again, that, as I said, if I go back, this will be ideal for somebody who, one, from a financial perspective, and secondly, maybe the upper third has Botox in it, or they regularly get Botox. So there's no real indication for you to then be putting this into the upper third of the face. Whereas here we have the full face protocol, which essentially will utilize 2 syringes. So the only thing that really changes here is, one, obviously the addition of the upper third of the face, and secondly, the volume that is now injected in each point. Again, we are going to use a 25 gauge cannula. So for the lower third, the lower half of the face, the protocol is the same as what I have just suggested. And for the upper third of the face, what you're going to do is having an entry point lateral over the lateral eyebrow. Okay, so anywhere you like. So if you palpate for the orbital rim here, anywhere, for example, 1 centimeter above, possibly even 2 centimeters above the lateral brow, depending on the height of the forehead and the reach that you need to have, you can have an entry point there. And again, fanning your 25 gauge cannula towards the midline or the middle of the forehead. And again, in each of these points, there's going to be a different amount of volume. This time is 0.3 cc, which is 1/3 of the syringe. And this is how you will then safely be able to use 2 syringes across the whole face. So let's look at the protocol. So what we suggest, and what I really like about this, recommendation, if you like, is it takes into consideration that everybody's different. You do have certain brands and products out there that will strictly say you inject the product, you wait strictly 4 weeks, and then you do it again, etc. Here, what we're saying is you do 3 sessions of treatment, which are 2 to 4 weeks apart. And the reason we say 2 to 4 weeks apart is because, somebody who, for example, has extreme skin elastosis and signs of aging may need treatment a little bit sooner, or they may even need more treatments. So it's nice to just summarize that what we are essentially saying is do 3 sessions, approximately 2 to 4 weeks apart, and then every 3 to 6 months, you basically bring the patient to the clinic, you review and assess them, and decide if they are fit to have another individual session of GOURI. This can be as little as 3 months, it could be as much as 6 months, if not longer, again, assessing everybody. But the base protocol is 1 session roughly every 2 to 4 weeks, and do that 3 times. So let's look at some key recommendations that will keep you safe. So what the top point is supposed to say, excuse my mistake here, and I will apologize, is a 25 gauge cannula. Okay, so a 25 gauge cannula is going to be optimal. Anything smaller, for example, a 27 gauge is too thin, and studies have shown that this could be equivalent of using a needle, therefore increasing the risk of adverse events. So 25 gauge cannula, some of you may be thinking, well, what length do we use? Sometimes you get 38 millimeter, 40 millimeter, even 50 millimeter. And again, this is down to personal preference. My own choice is a 50 millimeter because it's slightly longer, so it got more reach and coverage within the face. Topical anesthesia, again, I'm not going to go into this into too much detail because this is all going to be a personal preference and down to the individual clinician. After the treatment, gentle massage, I think, is always a nice thing to do. Patients are paying you money, it's part of their experience. A gentle little massage, it doesn't need to be vigorous, it doesn't even need to be rough, but just a gentle massage will help just spread this product. And the reason it's gentle is partly because of the composition, with it being fully liquidized. We are advocates and advise and strongly suggest actually that a antihistamine of your choice, whether it's loratadine, cetirizine, ranitidine, etc., is taken anywhere between 30 and 60 minutes pre-treatment. And the whole purpose of this is to reduce any possible risk of allergic responses, which sometimes in some patients can be very mild, a little bit of itching, a little bit of swelling. Again, just to reduce that risk, it's a very strong suggestion that we say to use an antihistamine pre-treatment. Post-treatment, corticosteroids, depending on where you are, country, city, etc. These protocols can vary, but even using something like 4 milligrams of methylprednisolone just for 2 to 3 days is somewhat beneficial. And the reason why we say this is because sometimes after using products like PCL-based products, the patient can expect some edema at least a few days post-treatment. Now, sometimes when they leave your clinic, they're looking absolutely fine, and the swelling, etc., can develop anywhere between 5 and 7, if not 5 and longer days after treatment. So sometimes it's a good idea just to give them steroids for 2 or 3 days, and that will keep the edema at bay, and that gives you a very happy patient. It can be used in conjunction with other products and treatments. It's quite safe to be used with Botox. I suppose they are used on different layers. However, when you're going to be using this with dermal fillers, make sure you do them on different sessions. And the reason I say this is, for example, let's say you did, I don't know, cheek filler with a product, and then you just did some cannula work for some contouring, and then you did the GOURI skin booster. If the patient then goes and has a problem, it may be tricky to understand what is causing this problem. So for that purpose, we do suggest using the dermal fillers at least 4 weeks either side of using the GOURI products. In terms of which way round you would do this, me personally, I would do the dermal fillers first. And that's because I'm a big advocate and a fan of injecting onto the periosteum to make the bone bigger again, because obviously as we age, we are aging on various levels, the bone, the muscle, the fat, etc. So the bone shrinks as we age. So if we make this bigger again, the skin that sits on top may look somewhat better and a little bit more taut. So that's my reasoning of doing the fillers first. However, some of my colleagues actually have the opposite opinion, where they think, right, let's address the skin first, and then we may not need to do anything deeper down. However, I'm still a big advocate of doing the fillers first. So what are the adverse events? It's an injectable at the end of the day. So some of these are going to be anticipated with any form of injectable, such as possible discomfort post injection, bruising, swelling, redness, any allergies, etc., like an itch, infections and nodules. Now, these have never been reported other than a little bit of discomfort, some bruising, a bit of redness, and a bit of swelling. So for this is the reason why we are suggesting that you use the steroids post-treatment for 2 to 3 days and an antihistamine prior treatment. Complications, again, this is probably the biggest fear factor of any injector. And, I can safely say none have been reported. And this does not mean that none can ever happen. And I suppose this is always going to be down to the injector, which is why we here at GOURI, suggest we have a protocol and you stick to the protocol. A lot of injectors, especially when you become very experienced, they like to do things a little bit off label, if you like, which I suppose in your own clinic, it's fine. However, especially when you're trying to get familiar with a product, stick to the protocol and you will remain safe and you will not have any complications. And just to summarize that, keep it simple. Assess the patient for the indications, topical anesthesia if need be, lateral entry points in the cheeks, and then you're going to fan the product towards the midline and inferiorly. And if they want the full face protocol, you can also inject the forehead too. Remember, for the antihistamine pre-treatment and the steroids post-treatment. So just keeping it very simple, and you can minimize the risk of complications. Going through the actual vascular anatomy is probably beyond the scope of this webinar. So, I'm not going to go into that much detail. But again, just keeping to the protocol and you will keep yourself safe away from vascular complications. Now, just to reassure you, when you are using a 25 gauge cannula, you will be in the subdermal layer. And once you are in this layer, you are in a very safe plane of the face. So, the fact that you are using a cannula, automatically you'll be safer compared to using a needle, for example. So again, stick to the protocol and you will be safe. So just some anatomical considerations. I think the thing here is just to be aware of the vasculature, as I said earlier on. I'm not going to be going through everything, but what this slide highlights, and it's a very powerful slide, this is the vessels that you see here in black and the vessels that you see here in red. We have obviously the external carotid system in the head and neck, and then we have the internal carotid system in the head and neck. And the most important thing here is knowing where the anastomosis. So I'll probably leave that with you guys just to do a little bit of homework yourself, just to see where the anastomosis occurs with these two blood vessel systems, because where they occur is arguably the most dangerous parts of the face. And again, where just as a rough guide, if you look at this image in front of you, you can see the supratrochlear, supraorbital, you can see the angular arteries as well. You can see roughly where the anastomosis will occur. And where are they? Generally speaking, in the midline of the face. So we're looking at the frown area, the nose, the nasolabial fold, etc. So where are we with our protocol? Well, first of all, our entry point is lateral. So we are away from the danger. And also we are using a cannula, which is somewhat safer than a needle as well. So a cannula will always be the preferred choice. Plus, it will be a lot more comfortable for your patient too. Aspiration, we strongly advise to aspirate where you can. Now, I know there's going to be a little bit of controversy. The reason I say aspiration was, if people, one, were following the old protocol, which did involve a needle, as some of you may be aware of this, and two, those that are just very anxious injectors like to aspirate no matter what they use. With a cannula, I'd like to say that you are going to be safe. So whether you aspirate, I will leave this down to you. It's an individual choice. Personally speaking, a cannula in the subdermal plane, there would not be any reason for me to aspirate, but again, it's a personal choice. A bit like using anesthesia. We can't tell the injector to aspirate. We can't tell you to use topical anesthesia. It's a personal choice. The most important thing in any aspect of facial aesthetics, not just with the GOURI products, but everything else, is the depth of where you're injecting. Whether you're using a needle, are you intradermal, are you subdermal, are you on periosteum? Whether you're using a cannula, are you above the SMAS, are you deep to the SMAS? The depth is the most important thing that we need to be aware of in facial aesthetics. So let's compare this to HA. So a popular product on the market is hyaluronic acid. We've all heard of Profhilo, which is HA, got a mixture of long and low molecular weight chains of HA. And the primary indication for Profhilo is hydration. Yes, you may get a secondary benefit, which is a little bit more firmness to the skin, some plumping to the skin. And that's because HA will also stimulate collagenesis, not directly, not in large volumes, but it will contribute towards the collagenesis aspect. So HA will still, to an extent, stimulate some fibroblasts. And Profilo, great product. You're limited, however, to your 5 points in the face. Okay, the bioaesthetic points, as they call it. So there is no protocol unless you were to go off-label for the upper third of the face. Secondly, it's a very thick, dense product to inject. It comes with a 29 gauge cannula. You inject this intradermal, and it's quite a thick product to inject. It's not very easy, can be quite uncomfortable for the patient. And again, when you have something with a lot of extrusion force, the risk of complications will also increase. Coming onto the actual fibers, points that Profilo use, there are a couple of points which are slightly higher risk than others. For example, 2 centimeters lateral from the alar, where you have facial artery, angular artery, and even the facial vein, which is probably closer. And then 2 centimeters medial from the tragus, where you also have the transverse facial artery. So some of the injection points are, in what I call high risk areas. Admittedly, if you are intradermal, you are safe. However, when you have a lot of extrusion force, as I said earlier on, sometimes your needle might wander a little bit too deep, and this then will increase the risk of a VO and other sinister complications. So what you'll find with PCL, it's a longer lasting product. And the main primary indication here is collagenesis, whereas with HA's hydration, with PCL, it's collagenesis. So yes, it will also contribute towards hydration. However, it's a collagen stimulator. It's going to stimulate your fibroblasts to produce collagen. You get that scaffolding to the skin, so you're likely to have longer lasting results. And it's all going back to the ECM. What do you have in the extracellular matrix? Collagen, elastin, water, hyaluronic acid. Okay, so by putting Profilo in, yes, you will be hydrating them with water, and yes, you will be putting hyaluronic acid in. However, you're missing out on elastin and collagen. So, nothing, well, Profilo in particular will not be stimulating collagen to the extent that PCL or GOURI does. Let's now compare this to other collagen stimulators on the market. So there are things like PLLA, polyallolactic acid, which is Sculptra, CAHA, so calcium hydroxyapatite, like Radies, and other PCL from Lancet. Now, other PCL products on the market, they obviously have the PCL. However, they have microparticles. Now, if you go back to the beginning of this presentation, you may have seen those 2 glass jars, and one was almost transparent, and the other, the product had dissolved right down to the bottom, and you could see the product. Now, that will be another PCL product on the market. And what you'll find there is the reason it didn't dissolve and particles just fell down to the bottom is because it has microparticles in it. What do these microparticles do is they add volume. So sometimes with other PCL products on the market, not only are you injecting the skin and you get a very nice result because you are producing collagen, but the microparticles can sometimes add volume. So if you have too much volume, this can give a very fake and very unnatural look to the face from a cosmetic point of view, but also then will increase the risk of having granulomas or in non-inflammatory nodules that may form in the weeks or months to come. So the fact that we have no microparticles in the GOURI product means there's not going to be any excessive volumization, and it also means that the risk of nodules and granulomas is actually pretty much minimal to none because it is fully liquidized. I've already mentioned that we don't need to prepare the product, for example, when using Sculptra. And lastly, as I said, it is fully liquidized. So the spreadability of this, for me personally, I find it second to none. So just having a look at a few images here, you can see the hydratedness on this patient's face on the right-hand side after using GOURI treatment. And this is after 2 sessions of GOURI, and you can see what we have here is it's a little bit more hydrated. Okay, you can see from the light reflex. it's a little bit more lifted. Now, GOURI will not actually lift the face. However, the collagen production, this is after 2 sessions, by the way, so 2 months down the line, the collagen production will tighten the skin as a scaffolding, and this may give the appearance of it lifting. And you can see the texture. If you compare the texture on the left-hand side, you can see very fine lines, very crepey skin, and you can see on the right-hand side, it's a lot more smoother. So this is another patient of mine who's had the full course, so 3 sessions. On the last image, you can probably gather she's also had a little bit of lip enhancement. So ignore the lips here. But if you look at the periorbital region, so look at the malar split, the infraorbital region, look at the nasolabial fold, just look at the hydration levels of the skin, look at the lower third of the face, just above the jowl. You can see the shape of a face as well. Everything has changed due to increased collagen production in the skin, which has hydrated and made it more plump and got rid of any fine lines and crepey skin. So again, some very powerful results there. That does bring me to the end of this presentation. Those are my Instagram handle that you can see there at the bottom. So if you do want to ask me any questions post-treatment, whether it's via email or Instagram, I'd be more than happy to answer any questions.